Welcome back to Champions of Care. We're talking about stroke today, and in this segment we're going to focus on the therapy options that get a person back to full functioning life following a stroke. With me in the studio is Dr. Jay Maythaler. Welcome.
Thank you for inviting me.
So happy to have you here. Now you are Professor and Chair of the Physical Medicine and Rehabilitation Program at the Wayne State University School of Medicine, in addition to all the work that you do as an Oakwood physician. So I really want to hone in and talk about therapy. Now we know strokes sometimes have the effect of causing some disabilities in people. Why is that?
When you had a stroke, you've affected some of the neurological connections to both your brain, from your brain to your various extremities. Within your brain, sometimes you can't translate now your thoughts into language. You have problems with reception of sensory inputs, whether it's visual input, not just on fine touch, but where your joint position is, and that affects your coordination because your cerebellum then can't translate motions. So it's anywhere in those neurological connections a stroke can happen. In fact, there's even been reported to be strokes in the spinal cord. It's just basically a lack of blood flow damaging part of a neural pathway somewhere in the central nervous system.
In our program today, we've really stressed to viewers that the best thing they can do is get to the ER fast. Is a disability from stroke inevitable?
No. In fact, number one, the first leg is prevention. It has been proven that we can prevent strokes, as I'm sure the other physicians have talked about. Secondly, getting to the emergency room quickly can limit at least the damage from the stroke, if not obtain full recovery. The third leg, of course, is rehabilitation. For those who have suffered some functional limitation or disability from a stroke, rehabilitation and therapies, along with certain medications, can enhance your motor, cognitive, and psychological recovery from a stroke.
Now, I'd love you to talk a little bit about the types of disabilities that could result from a stroke, and also how do you create a treatment plan for each patient?
Well, because stroke can be so variable, affecting various different pathways, it can be various different sizes, one treatment pattern obviously does not fit all patients. But there are a series of disabilities that are well known. First off, the obvious motor weakness in an extremity. If there is some residual motor function, there is a significant amount of neuroplasticity that can be accessed in patients.
Can you explain what that is, neuroplasticity?
Neuroplasticity is a combination of factors in your brain, but basically it's not just regrowing new neural pathways, but it is using accessory or latent neural pathways that you have not used to access a speech and language center, a motor function in your hand or your leg. Most patients, and the old statement is you only use 10 to 20% of your brain, is actually true. But like the other therapies, time appears to be of the essence in rehabilitation. The first 6 months are the most important. And so the therapy needs to be of a proper intensity, probably according to the National Institute of Health, 3 to 5 hours a day. And it needs to be obtained as much as possible in the first 6 months, as 80% of your recovery will be in the first 6 months. This is not to say that chronic stroke patients don't obtain motor recovery. As Ed Taub's medical director in constraint-induced therapy, we proved in NIH trials that patients did improve recovery more than 1 year out. In a new study that I published just 2 years ago, we focused on neurodevelopmental techniques on just the upper extremity, with or without the use of medications such as Botox to enhance motor recovery, and found that you could improve recovery even more than 6 months out. But it is most important to get into your rehabilitation early.
You know,
Again,
that's interesting. That's another reason to keep fast in mind in the area of stroke.
exactly.
Get to the ER fast, and right after that stroke, start your rehabilitation.
Some of the other issues that happen, and there is a progression of events that happen after stroke, is that you start to develop dysfunctional motor movements. These are usually due to patients who are not using their extremity appropriate now, and probably in more primitive patterns. These pathways need to be inhibited because they can develop things such as spasticity, high tone, or better known as dystonia, and the patients can't use the residual motor strength or coordination they have. So therapy makes a big difference, along with various medications that can limit these motor pathways that are dysfunctional. Most of them work on neurotransmitter pathways.
Well, let's talk a little bit more about therapy options. And actually, we have a video to show. Champions of Care reporter Rahul Jadia visited Oakwood Heritage Hospital to teach us a little bit more about therapy options. Let's have a look.
Thanks, Mary. I'm speaking with Rachel Helm, an Oakwood occupational therapist, about therapies that can help people recover from stroke. Rachel, thanks for being with us.
Thank you for having me.
Rachel, what is an occupational therapist?
An occupational therapist is a therapist that would work with a patient to help them regain their function and their ability to take care of themselves for their daily activities. It could be regaining their function to complete their dressing or bathing or feeding, or their home management, such as cooking or safety in the home.
And how is an occupational therapist different from a physical therapist?
Well, typically following a stroke, a physical therapist might focus on the person's walking and their balance, and their ability to use different types of equipment, such as a cane or a walker, or things that they might need for their safety. Whereas an occupational therapist, we focus on the person's ability to complete their daily activities, such as dressing, bathing, feeding, kitchen skills, home management, safety and transfers in the home as well.
Being that the therapies are so different, if a patient were to have a stroke, how is it determined which therapy they get?
Typically, following a stroke, a person's admitted to an acute care setting. At that time, the rehab services will evaluate the patient. The rehab services would include physical therapy, occupational therapy, and a speech pathologist. We evaluate the patient, and based on their deficits, we come up with a treatment plan to help determine which therapies would be beneficial for the patient.
So if it's determined that occupational therapy is necessary, what kind of areas does an occupational therapist evaluate in terms of a stroke patient?
With a stroke patient, we typically focus on the person's upper extremity, their hand function, as well as their trunk control and ability to complete daily activities in a safe manner and to be as independent as possible in their home.
Now, I know that some therapists have advanced training with stroke rehabilitation. I believe this training is called NDT. What is NDT?
NDT stands for neurodevelopmental treatment. It's a specialized treatment approach where the therapist learns to work with the patient following stroke in the recovery. We help the patient regain the strength and function of the involved extremities and trunk so the patient can resume their daily activities and be safe in their environment.
Does Oakwood have any therapists that are certified in NDT?
Yes, we do have some therapists that are certified in NDT, and several therapists have specialized in this area of expertise.
It's obvious that therapy plays an important part with someone who's recovering from stroke. How long can a patient expect to be in therapy for?
Well, based on the patient's needs following a stroke, they're typically transferred to a rehabilitation center where they can stay for 1 to 2 weeks to receive intensive therapy services. If the patient still needs continued therapy, they can transfer to what we call a subacute rehabilitation center where they can stay from 2 to 4 months or longer if the patient requires treatment. After that, they're typically discharged home. Home care services are available if the patient needs additional therapy, or outpatient if they're able to be transported to an outpatient facility.
Rachel, well, thank you so much for helping us understand stroke and recovery from stroke using therapies.
Dr. Maythaler, can someone completely recover from a stroke?
Yes, of course they can, and there are patients that do. But many other patients can definitely be enhanced in their functional status by rehabilitation, whether it's a motor function or a speech and language. And some of the side effects of stroke, such as depression, can be readily treated by medications and or psychological therapy.
Sometimes depression after a stroke could keep people from getting right into therapy.
It's a holistic approach to medicine. One needs to work as a team. We need to approach all the sections of how somebody, or all the areas that have been affected by the stroke. So that includes your thinking skills, your cognition, your memory abilities, as well as your motor functions and your speech and language functions.
Well, you talked about a whole system approach. When someone is recovering from stroke, how can their family members help? Or someone who's watching our show today, how can they help someone they know who's suffered from a stroke?
In research, it's been shown recently in stroke as well as in traumatic brain injury that family involvement may be the most important part of recovery from any of these disabilities. Patients and families, their families reinforce the therapies at home, their treatments at home, and this may be the most important issue about recovery. They improve the psychological welfare of the family, of the person who's been affected by the stroke. They encourage them to work through their therapies, which can be very frustrating at times. But what you get back from a stroke, you usually get to keep.
Oh, that's a good fact to close on. Dr. Jay Maythaler, you are a stroke expert. Obviously, you've done a lot of research in this area. We're so happy that you are a physician practicing in this area. You're with the Oakwood Healthcare System. You're also chair and professor of the Physical Medicine and Rehab program at the Wayne State University School of Medicine. Thank you so much for being with us today.
Thank you for having me.
I also want to thank Dr. Daniel Singer, Dr. Vito Rocco, and the whole physical therapy and rehabilitative therapy program at Oakwood Healthcare. To find out more information about these physicians, these healthcare professionals, go to oakwood.org. Look under neurological care and you'll find even more information on stroke. I want to thank you for tuning in today, and I hope you'll join us again for Champions of Care.